Hello everyone, I'm Tiffany from First Step Fertility. Today I'm really glad I'm here and with Dr. Mosa, and we were talking about some questions about donation and about the surrogate, also about our intended parent cycle. Hi Dr. Mosa.
Welcome here. I'm so glad to meet with you in person. Hi everybody, I'm Dr. Mosa, the Medical Director of American Fertility Medical Center. I'm so glad that I'm meeting now with the First Step team here at American Fertility Medical Center in Diamond Bar, California. Let me give you a little bit information, introduce myself at the beginning. I've been working in the field of infertility for around 20 years. I have long years of experience. I'm so happy that I'm always helping some patients, some families to be building their families and to be enjoying their life the way they want. We had several cases with the First Step team, and we have good success rates, and I'm so happy now to meet with you guys and to answer your questions again.
I have a question for our intended parents. How to choose a good candidate for egg donor or surrogate mom?
Okay, that's a great question. The number one is to be sure that whoever want to be the egg donor or the surrogate mother is totally healthy. We follow the FDA guidelines to be sure that there is no disease, nothing, no smoking, no drinking, no crazy lifestyle that might affect the baby. Again, the whole idea of our work or our job is to give the family a healthy baby. That's our goal. So when you look at your goal, you want to be sure at the beginning to when you are processing the baby, which is the IVF, you need to be all your steps are sure. You test the baby, BGTA, the baby is normal. Now you want to go to the second step, which is having the baby in the uterus and to be until the delivery. So we want to be sure there is no infection disease that might affect the baby. We want to be sure that the lifestyle of the gestational carrier is so good that there is no crazy lifestyle, no smoking, no drinking, no sexual transmitted disease that might affect the baby. That's very important. We want to be sure that there is no drug use because that will affect the baby. We want to be sure that there is stability in the psycho-emotional status of the gestational carrier. That means because when you are pregnant, if you are getting nervous or anxious or anything, that will affect your baby, the baby that you're carrying it. And that's the most important, that we go with all the steps that guarantee that we are having good mother or good carrier, that can you be assured that when you have your baby with this uterus will be okay. Another point is always with gestational carrier, we need to be sure that she carried baby before. We look at her OB history and be sure that she has normal pregnancies. And if she was gestational carrier before, we want to be looking in details about the history of transfer baby. How was it? Did she fail? Did she not fail, etc. For the egg donor, we have extra details other than being about all what I mentioned. Blood test, no medical. We want to be sure that there is no genetic medical disease. That's very important for the egg donor. Sometimes we as a human carry some genetic disease in our body, but it does not show. We might pass it to our children. So the most important is to do genetic carrier screening test for the parents, for the intended parents, and want to do the genetic carrier screening for the egg donor. Want to be sure that they don't have the same disease inside it, because if both carry the same, it will show in the baby. So that's the most important thing, is to be sure that she's healthy, she has good lifestyle, and want to be sure about her genetic carrier screening. And of course, the characteristic is going to be chosen by the IPs. I hope I answered your question. It's a process, detailed, and usually we are very meticulous in looking into all these details.
Yeah, thank you very much. I think this is quite clear. The genetic testing and the PGS helped a lot. It sounds like IVF baby is like a lower risk even than the natural pregnant, right?
Exactly.
And it's already a lot of things and the test and to lower the risk.
Exactly correct. And you cannot invest in this long journey without having some assurance or some testing and screening during this process.
Yes. And I have one last additional question. I think a lot of intended parents, they're really panic and anxious. Sometimes they're keeping asking the third party, ask us how I can guarantee this donor is that one I choose. Even we give them photos when she come to the clinic, take a photo with the clinic or even with the doctor. They also feel like some worry about it. Is this the person and I matched with?
Of course. This, like in the United States, there is strict regulations about this. We as IVF Center will be always, and every center in the United States is always audited for all these steps. They think like whatever you signed, your legal contract with is guaranteed to be done. And if they have any problem, we can offer them these genetic testing that shows that this is the person that you did signed with. So this part, I want them to be totally relaxed, because this cannot be neither with us nor with any center. This is strict regulations in the United States.
Yes, I think so. And this is a great because the clinic is like the core part is like in the middle, because the donation is anonymous for intended parents and the egg donors, but it is not like anonymous for the clinic. The doctors will say all her name and ID and everything to make sure.
For us, we know, but we hide this information by law. We give them a code like A number whatever or B number whatever. They are here in the names, but we know them and we screen them, and we are unable to skip any important lab test or screen that is required. I want to assure them that everything is very, very accurate.
Sounds great.
Okay.
Thank you very much.
I hope that will help.
What would you say to someone who is considering become an egg donor or surrogate?
Oh, that's great. You know, I always advise and encourage them, if they are fully healthy, if they are done with their families, to go for it. Like as a human, it's so good to help others. And if you can help others without affecting yourself, without harming yourself, is the best way to deal with it. It's so generosity for anybody who want to help somebody else. And helping others is different from one person to another. Me as a doctor, I have to be sure that all the steps are correct. This will be no harm. Our first like principle is to do no harm. If there is no harm, we examine and test and screen the surrogate or the GC or the egg donor patient. Everything is normal. That will not affect the surrogate or the egg donor. That will be perfect. At the same time, we can be sure that everything is healthy, because also we want to protect the parents, the IPs, what we call it, the IPs. So I really encourage them and assure them that everything will be in a smooth way and there will be no harm for any parties.
I'm so glad that today Dr. Mosa shared those so valuable information with us. And I also hope this can help the donors and the surrogate moms from first step fertility, also the intended parents. Thank you very much.
You are welcome.